Another huge increase in the country's COVID-19 tally. 4,578 new infections were logged today. This is the highest daily rise since September the 12th of last year. But experts warn figures could go much higher by the end of the month. Let's break down the numbers and the reason behind the surge. We now go above and beyond the headlines with a member of the Health Department's Technical Advisory Group, Dr. Anna Ong-Lim. Dr. Lim, thank you so much for joining us. 4,575 cases, daily numbers we have not seen since September of last year. Is this a major concern for you?
Yes, definitely, Rico. As you said, this is really the first time these numbers have gone up to this extent. And I think it's really a wake-up call for everybody to try to do their best to contribute towards containing this new increase in cases.
So, Dr. Lim, are these rising cases due to the South Africa, the UK variant, our very own Philippine variant, or are our kababayans not just following minimum health standards?
Well, it is true that we've been picking up variants among the positive cases that have undergone whole genome sequencing. But likewise, the proportion of cases that we're attributing to the variants are quite low. No? They're actually under 5%. And so it's very hard to say that the major driver for the increase in cases is due to the variants. Likewise, when we look at people going around, we do notice that many people have become quite relaxed in the use of their personal protective equipment, face shields, face masks. And I'm sure this is also contributing to our problem.
So if our kababayans are becoming quite relaxed and we will continue to see a rise in infections, and Okta research has said that it could even peak at 6,000 before the end of this month, is a curfew from 10 p.m. To 5 a.m., granular lockdowns sufficient to curb the rise? Or should we return to stricter quarantine restrictions just like a year ago when the president imposed ECQ?
Well, if you were to ask me as a health person from the health field, of course, my answer will always be yes, let's lock down, if that's a personal question for a personal opinion. Because that's really the approach that health will take. If you have an increasing number of cases, then the first thing you do is try to stop people from moving around and make sure that you can contain to a smaller proportion of the population. But the thing is, these decisions are not actually made just by the health sector alone. We recognize that considerations about the economy are also very important. And we need to find solutions that will be able to marry both of these issues, no? Making sure we save lives and at the same time we maintain or we sustain livelihood.
So personally, Dr. Lim, what could be the solutions? How can we nip these cases in the bud?
So thanks for asking that question, Rico.
Yeah.
I think there's been a lot of emphasis on reminding people about using their masks and shields correctly, making sure that they distance, they have to be in places which are well ventilated. And that's all very well and good, no?
Yes.
Because these are critical cornerstone actions that everybody should have mastered by now. Dapat hindi na natin ito pinaaalala sa mga tao. But the other thing that we might move forward on is a higher level of controls. There's what is called the hierarchy of controls. It's an inverted triangle where the use of personal protective equipment is at the bottom of the list. Because it's behavior driven, it's very difficult to make sure that people are compliant 100% of the time. So maybe we should go up and look at some system controls or engineering controls that we can impose on a community-wide level so that people are enabled to add or are enabled to comply, and we can add all of these other measures to controlling the spread. So as an example, DOLE has actually come up with this new ventilation guidelines for the establishments. I think that will be helpful. And another thing that maybe I would like to remind everybody about is when you're sick, please don't delay. Seek consult. Make sure that you isolate and quarantine because this will be very critical in saving your family and your community.
So if you're starting to already to show some kind of symptoms, a cold, a cough, sore throat, immediately see a doctor or consult a doctor.
Yes. Yes, please. No, don't let it pass another 24 hours because that can spell the difference between infecting your family members or your workmates, and that will be a very big factor in helping to control the spread of this disease.
Thank you so much, Doctor, for that advice. But if you break down the caseload that we have been seeing over the past few weeks, from 2,000, 2,500, 3,000, and all the way up now to 4,500, which could even reach 6,000, are we seeing, Dr. Lim, a rising infection rate among children, among kids?
Oh, so anecdotally, because I also do work with the hospital, and we do manage our pediatric patients. Right now, we haven't been seeing an increase to that extent, no, an exponential increase. But you have to consider, if you have more cases in the community, it's not very far off that you will have more kids and more elderly being affected as well, because they come in clusters. It's families being infected, and our families are really multi-generational. And we need to be able to stop this chain very, very quickly.
Of course, apart from nipping it in the bud and the solutions that you just presented, Dr. Lim, we also have to ramp up the vaccination drive. We just can't have more than 1 million doses here in the country, because Senator Panfilo Lacson just said earlier, if we continue with this pace of vaccinating our kababayans, it will take 11 years.
Well, this campaign is unprecedented. We've never targeted this many people in any vaccination campaign globally, because most vaccination campaigns have usually targeted children, which make up a smaller proportion of the population, or maybe the elderly. But now we're talking about everybody, with the exception of children. So we do need to step up. We need to think about innovative solutions. There are countries that have done 24/7 vaccinations, and I don't see why we can't do that here. And maybe we need to get all hands on deck. Public, private sector can help so that we can get a dent on this very, very quickly.
Thank you so much for your insights, infectious disease specialist, Dr. Anna Ong-Lim.